Let's talk about the ventricular system. What are the ventricles? Ventricles are basically four fluid-filled cavities which are located within the brain. There are two lateral ventricles, a third ventricle, and a fourth ventricle. The two lateral ventricles are going to communicate with each other through the interventricular foramina or the foramen of Monro with the third ventricle. And the third ventricle is going to connect with the fourth ventricle through the cerebral aqueduct or the aqueduct of Sylvius. The fourth ventricle is going to continue with the narrow central canal of the spinal cord, and then it is going to communicate with the subarachnoid space through the three foramina in its root. The central canal in the spinal cord has a small dilatation in the inferior end, which is the terminal ventricle, and the ventricles are lined with the ependymal cells and they are filled with CSF. They are developed from the cavity of the neural tube. Now let's talk about the lateral ventricles. So we have two lateral ventricles all in all. One lateral ventricle is each cerebral hemisphere. What are lateral ventricles? They are basically irregularly C-shaped cavities. They have a body which occupies the parietal lobe. The body is going to be divided into three horns: anterior, posterior, and inferior horns. And the body is going to communicate with the third ventricle through the interventricular foramen, which is anteriorly bounded by the fornix and posteriorly by the thalamus. You can remember this with FT. So body is going to extend from the interventricular foramen towards the posterior end of the thalamus. Body with B, I with the interventricular foramen, and T with the thalamus. And then they're going to divide into posterior horns and inferior horn. So let's talk about the body of the lateral ventricle. So it has a roof, a floor, and a medial wall. What is the roof composed of? Roof is made up of corpus callosum. What is the floor made up of? It is made up of TC. T for the thalamus lateral margin and C for the body of the caudate nucleus. Now let's talk about the medial wall. So the medial wall is always going to be made up of septum pellucidum, which is a boundary which is going to separate two lateral ventricles. So septum pellucidum is going to be present anteriorly in the medial wall, and posteriorly in the medial wall, the roof and floor are going to come together. And also some things to remember: the superior surface of the thalamus is obscured in the medial part by the body of fornix. Choroid plexus is going to project into the body of the lateral ventricle through a slit-like gap which is present between the body of the fornix and the superior surface of the thalamus, FT. So this is the choroidal fissure. Through it, blood vessels are going to invaginate into the pia mater of the tila choroida and the ependyma of the lateral ventricle. Now let's talk about the anterior horn. So it also has a roof, a floor, and a medial wall. So it is going to be continuous with the body of the ventricle through the interventricular foramen, and the roof is going to be made up of corpus callosum anteriorly, and genu of the corpus callosum is going to limit the anterior horn anteriorly. What about the floor? The floor is always going to be made up of caudate. So this time the floor is going to be made up of the head of the caudate. Now let's talk about the medial wall. Medial wall is going to be made up of the septum pellucidum and the anterior column of the fornix. Now let's talk about the posterior horn of the body of the lateral ventricle. So it is going to be present in the occipital lobe. When we talk about the posterior horn and the inferior horn, always remember that the roof is always going to be made up of tapetum. So the roof is going to be made up of the tapetum of the corpus callosum, and the lateral wall is also going to be made up of the tapetum of the corpus callosum. Posterior horn of the body of the lateral ventricle does not have a floor. So we are only talking about the roof, the lateral wall, and the medial wall here. Lateral to the tapetum, the fibers of optic radiation are going to be present, and the medial wall is going to be made up of two elevations. And these elevations are classified as superior swelling and inferior swelling. So the superior swelling is going to be made up of forceps major, which is actually the splenial fibers of corpus callosum. The superior swelling is also called the bulb of the posterior horn. Now let's talk about the inferior swelling. Inferior swelling is the calcarine sulcus or the calcar avis. Now let's talk about the inferior horn. Inferior horn is going to really extend into the temporal lobe, and the roof is going to be made up of tapetum and the tail of the caudate, and the floor is going to be made up of laterally the collateral eminence LC, and medially the pes hippocampus MP or MH for hippocampus. So hippocampus is actually just made up of pure gray matter. However, the ventricular surface of the hippocampus is made up of white matter, which is actually called the alveus, which are made up of axons of the cells of the hippocampus. And the alveus is going to converge on the medial border of the hippocampus to form fimbria, and the fimbria are going to be continuous with the posterior column of the fornix. The tail of the caudate is going to be continuous with the amygdaloid nucleus, and medial to the amygdaloid nucleus we have STM, which is the stria terminalis medullaris, and anteriorly the stria terminalis is going to end into the amygdaloid nucleus. Just remember SFC. Between the stria terminalis and the fimbria, there is a temporal part of the choroidal fissure. Here, the lower part of the choroidal plexus of the lateral ventricle is going to invaginate the ependyma medially, and it is going to close the fissure. So the choroidal plexus is actually irregular lateral edge of the tela choroida, which is actually just two-layered fold of pia mater between the fornix superiorly and thalamus upper surface. Choroid plexus is a vascular fringe which is made up of pia mater lined with the ependyma. Between the body of the lateral ventricle and the inferior horn, the choroid plexus is continuous into the inferior horn, and it is going to project through the choroidal fissure. And the function of the choroidal plexus is CSF production.